Diabetics and the dentist are linked more closely than you might think. Dr. Charles Martin joins us this morning to explain why diabetics and pre-diabetics can have a harder time with their teeth and gums. All right, now, you know, diabetics is something that's very serious.
Yes, it is.
And it is linked to the dentist and a dentist visit.
Right.
How is that?
Well, there are 20 million diabetics in this country, type 2 diabetics. That means they're diabetic as an adult, age 45 plus typically. There are another 40 million that are pre-diabetic. That means their blood sugar level's almost a level where they're diabetic. Here's what happens. The diabetic has less ability to fight infection.
Okay.
Okay? And it's because of blood sugar levels. It alters response to infection. The teeth that have infection in them cause the diabetic condition to be more difficult to control. So the diabetic condition makes the infection of the teeth worse, and the infection in the teeth makes the diabetes worse, and can take someone who might not have been diabetic.
So it's like a catch-22.
It's a closed loop, and
yeah.
it's a vicious one.
Yeah.
It's scary. Diabetes is on the rise. It's a real. The CDC calls it epidemic. The incidence has doubled in the past 25 years. The CDC now says that 1 out of every 3 children, 1 out of every 3 children born after year 2000 will be diagnosed as diabetic during their lifetime.
All right, so we've got this epidemic. You've got this closed loop that you talk about. When you go to the dentist, is the dentist able to take a look at our teeth and say, wait a minute, hold on?
Right. Well, we're learning more about diabetes all the time. You need a dentist who's paying special attention to this problem. I formed a national organization called Dentistry for Diabetics for this reason. And what we do is we do pay special attention. We are aware of the ramifications and the concerns that a person should have about their teeth because of their diabetic condition. What the regular person can get away with, so to speak, with their teeth, a diabetic can't. So they've got to be much more attuned to getting their teeth in excellent oral health.
All right. Let's say there's somebody watching right now, and they're having some problems with their teeth. And not that we want to scare anybody, but are there any things that they would notice right off the bat without going to the dentist?
Well, I mean,
they need to get there.
Okay, so if their gums bleed, that's not good.
You're going to notice that.
Yes, if your gums bleed, it's not good if you're diabetic or pre-diabetic. Number 2 is that if you have bad breath that won't go away. If you've got dental problems you know that you have, it is, you're just basically, twirling the gun on your health by doing that. And see, for a diabetic, it really can save their organs because diabetic condition causes a breakdown across different organ systems. All
right, let's do a before and after because I enjoy these much more. You're scaring me here. All right, tell us the story with this picture here.
Well, this lady had what I call mosaic teeth. Didn't like the way they looked. And wanted to have a smile that made her proud, and it also makes her look, I think, a bit younger. Wouldn't you agree?
Yeah, definitely.